2012, and that budget doesn't even include all of the war costs for Iraq and Afghanistan. Money is going to be very tight. Also new this year, now looking at the Republican side, is that there is no proposal for new net spending on health care, and that's something new for Republicans too. Again, last couple of elections, Bush had a significant expansion proposal. If you listen to Senator McCain or any other Republican that was running before, none of them were proposing new spending expansions. They were proposing steps like reforming the tax treatment of health insurance to try to get the federal dollars that are being spent through tax expenditures or other means to go further to cover more people, but they weren't supporting an expansion of federal spending. And that's understandable from a Republican standpoint, because the federal government, if you add it all up between Medicare and Medicaid and the tax expenditures on health insurance for people with employer-provided coverage, that's more than $1 trillion per year in federal spending now, and growing very rapidly. In fact, according to most budget projections, the increases in spending for Medicare, Medicaid, and the tax expenditures for health insurance account for most of the increases in federal government spending overall over the next 5 and 10 years and beyond. So there will be an opportunity. I think the good news in all of this is that there will be an opportunity if and when we get nominees for both parties. I thought it was going to be over by now, but if and when we get nominees from both of the parties to have a health care reform debate that for the first time is really going to be about reforming health care, not just about buying more people into our current health insurance system because we can't afford to do it, but about reforming the way that health care is provided. And it's time for this change in how we think and talk about coverage reforms, because there is growing evidence, practical evidence, that we can take steps to spend the money much better in health care. Not only are there all those gaps in overuse and underuse and misuse of medical treatments that I talked about before, but there are programs around the country, healthcare providers and patients working together who are doing it right, who are doing better, who are putting more emphasis on preventive care and wellness and heading off costly complications before they happen. More emphasis on coordinating care for people with chronic diseases who typically see multiple specialists and may be on multiple kinds of medications or getting multiple different medical treatments that in the past have not been well coordinated. New steps to help patients navigate our whole complex healthcare system, to have patient-centered healthcare that's focused on the needs of a patient, not the needs of all the providers that are treating them. These kinds of steps are what I mean by real healthcare reform. This is what our healthcare system should be driven every day to achieve and should be supported in achieving. But as those of you who are involved in healthcare know, I know there are a lot of medical professionals here tonight, and also those of you who have encountered our healthcare system know, progress towards much more efficient ways of delivering healthcare in this country has been anything but rapid. And this is where healthcare policies and policy reform, I think, really comes in. In contrast to most other industries, if you take steps in healthcare to improve quality and lower